So for the KUB that we see here, this does have our equipment. There's an IR down here, and you can see they've already placed their right marker, which will be on the patient's right side here in the bottom right corner. The anatomy that will end up in this bottom right corner will be the hip. So it's that hip area is of less interest than the rest of the anatomy that will end up on this x-ray. So that is a good spot to put it. All right, in the meantime, for this KUB, which stands for kidney, ureters, and bladder, we have a 44-inch distance from the IR to the tube. So you would see 44 inches on that display for the x-ray tube. We've detented it to make sure that this mid-sagittal line here, when this IR plate is pushed all the way in, is underneath the table and you can't see it anymore, these lines are your only guide to make sure that you are lined up with that IR that you cannot see. So we got to make sure that's detented. And then this cross line here is set at the level of the iliac crest. You can almost see it on this patient. Remember that, sorry, let me pull up my pencil. Here we go. Remember that, where is it? The iliac crest, sometimes you can palpate what we call the ACEs here, and then you could follow it up. Here would be the iliac crest, you're trying to palpate, and that's where you put the center line there. Sometimes techs might use the belly button trick where they have the patient point to the belly button and they use that as a guide. A lot of times on sthenic people, for the most part, maybe a hyposthenic, like that sort of thing, but that belly button usually lines up with the iliac crest. And let's see if I missed anything. Make sure it's in the bucky or that you're using a grid, which you'll go over with Mrs. Cox and we'll go over a little bit later on. Again, there was that 44-inch distance, no shielding. Immobilization is going to be in the form of your breathing instructions. Believe it or not, breathing instructions are a form of immobilization, in which case at this KUB, before you take that x-ray, what you're going to do is take it on expiration. So you're going to say, please take a breath in, let that breath out, and then hold it out. And then you're going to watch to make sure that the patient is following the instructions. What this does is when we take a real deep breath in, right, we're making our lungs a little bit bigger. And by making them bigger, we're expanding them. And that's going to push that diaphragm down when we expand the lungs. When we take a breath in, our lungs go back into a little bit smaller state. And so the diaphragm is going to move back up during an expiration. And what that does when the diaphragm moves up on expiration, right, we're letting the air out, shrinking the lung a little bit. That means all the abdominal organs are less compressed. And for this KUB image, that's what we want.